Hello all, my name is Reggie Gackett, and I want to welcome you to the first webinar in the 2019 Family Webinar Series. I am the Assistant Director in the First Year Center, and tonight I am joined by my colleague Erin Darty from the Habif Health and Wellness Center. We are excited to have chosen to join us for tonight's conversation. Some information before we get started. First, you will notice that we have given you the ability to submit messages to us during this webinar using the chat function. Please use this feature to ask us questions. These questions will only be seen by staff in the First Year Center and our panelist, Erin. Two of our graduate students are helping to field these questions. We will answer those we find applicable to the audience as a whole on this webinar, and will respond to more nuanced or personal questions via email later this week. Let's go ahead and make sure you know how to use the chat feature. Send us a chat with the place you are watching from, and we will name a few of these places on air. While you do that, the webinar is being recorded live. After finishing tonight, we will upload this webinar and frequently asked questions on the topic to the families.woostel.edu website. Lastly, in a moment, we will hear from Erin about the services offered by Habif Health and Wellness Center. If something Erin says sparks a question, don't forget to chat us. After hearing from Erin, we will move into the Q&A portion of the evening. Before passing things along to Erin, I want to share some of the places people are joining us from. We have families tuning in from San Jose, California, Baton Rouge, Rochester, New York, and many other places. Now, since I know you all want to hear more about our health and wellness resources, I will turn it over to Erin.
Great, thank you very much, Reggie. And thank you for letting me have the opportunity to be here tonight, and good evening to all of you out there. Again, my name is Erin Darty. I am the Associate Director of Administration at Habif Health and Wellness. I just want to share a little bit about some of the services that we offer and then what we can do for your students as they come on board next year. So Habif is a comprehensive and integrated health center providing for the physical and mental health needs of Washington University students, as well as some health promotion activities. So we provide for all of the undergraduate students as well as the graduate students here on the Danforth campus. Our executive director is Dr. Cherie LeBlanc. She is a board certified physician with over 30 years of experience in college health. We really break our department down into three sections. We have our medical department, our mental health department, and then our health promotion services. Within the medical side, we have 5 additional primary care physicians who are all board certified in one or more areas. Some are dual certified. We have a nurse practitioner who's dedicated towards women's health needs, 2 physician's assistants, 4 registered nurses, 4 certified medical assistants. And then we also have a radiology department that provides basic diagnostics for sprains and breaks and chest x-rays. So if your student, running down the stairs on their way to class on the first day of classes and trips and sprains an ankle, we can take a look at that and determine what the course of action will be. We also have a pharmacy on site that is capable of providing for most prescriptions, pretty much anything that doesn't require compounding multiple drugs together. We're going to go provide that at our pharmacy, which is known as the quadrangle pharmacy there at Habif. And then we have a lab core on site as well that can do a lot of diagnostics, taking samples and doing various blood tests and things of that nature there on site. Switching to the other side, within our mental health department, we have 6 psychiatrists, 13 therapists who are all either licensed psychologists, licensed clinical social workers, professional counselors, or marriage and family therapists. And then we have a care manager who can help students navigate resources for mental health needs, either on campus or in the community around Washington University and Greater St. Louis. And then finally, we have our health promotion team, and that consists of 3 professionals that organize events across campus related to healthy eating and sleep habits, mental health, healthy relationships, sexual health, and alcohol and other drug abuse prevention and recovery. So a broad array of services that we provide at Habif. We really intend to be the medical home for all of our students, the kind of their first stop shop to get their medical needs met. And we're happy to be able to provide that service to help support them as they're attending here at Washington University.
Thank you, Erin, for sharing all of that insightful information. While hearing you speak, I was reminded of a question that I have for you. How quickly can students get appointments with Habif staff?
Yeah, really great question. So for both medical and mental health, we have daily urgent care walk-in appointments. So students can walk in, if they woke up in the middle of the night with a migraine or, having a fever and some headaches or maybe some mental health concerns around stress related to studying or a project they're preparing for. We can take those students every day as a walk-in for those urgent needs. Aside from that, we have daily appointments. All of our appointments open up 18 hours prior to the appointment time, kind of a rolling cycle. So we always have appointments opening. So again, if a student wakes up in the middle of the night and they've got a fever of 101 and they're not feeling well, they can get on their computer right then, log in, and grab that appointment. They'll be there the next morning when they come in. Again, we take the urgent care needs as well. And then from the mental health side, it's going to be a little longer of a wait. We have a lot of services we're providing, a lot of students we're providing for, but typically we can get a student in for more ongoing appointments within a week or two. But those urgent needs are there every day.
Thank you. So we've started to receive questions from attendees, so we'll begin now to answer them. Where should my student go in a medical emergency?
So a medical emergency, if you're on campus during an emergency, we encourage all of our students to call the Washington University Police Department. You'll get to know them as Blue PD, and we refer to the fist of fives. 55555 will get you directly to Wash UPD. That is the fastest service for emergency needs. They can dispatch our emergency service team, which is a student-run group, all certified EMTs, and they can be dispatched there to assess and stabilize things. If a student is going to need to be transported for emergency care, WUPD is going to be able to get paramedics there faster than anyone else here on campus. So that is really the best option for those true emergencies. If you're off campus, obviously it would be dialing 911 and going through that process. The majority of our emergency cases, we do transport those to Barnes Jewish Hospital emergency department, which is just across Forest Park and on the same campus where our medical school campus is located.
Another question that we have is, can my student waive their HIPAA rights so I can see their records?
So yes, they can. Anyone has the legal right to waive their HIPAA rights. There's kind of a process around that. Students would have to come to the health center to fill out a release of information to have their records released to their parents. And that's only good for 6 months. So they would need to return, and always has to be done in person in the health center. Now, in converse of that, we really do encourage this to be a time where students start to gain a little bit of independence and a little bit of responsibility for their own medical care needs. Obviously, it's a tough time for parents as they send their kids off to this strange, faraway place in the middle of the United States. But we really do encourage students to start to kind of take some of that responsibility on their own. We want to be a great resource for the students, and an important part of that is building trust with our physicians, building trust with our providers, and knowing that they can kind of talk about some sensitive subjects and things with their provider. That's important for them. So yes, students absolutely can complete release an information form. It would have to be done every 6 months, and we can share information with the parents. But we also, again, we do encourage the students to start taking some responsibility there. If a student is sick, we always encourage them to include their parents in that process. Allow us to reach out to their parents on their behalf. If it's going to be something a more significant illness, but if it's an emergency and a student is incapacitated, we of course would be reaching out to parents immediately. But without their permission, we typically will not be notifying parents if their child's sick.
What kinds of insurance are accepted?
So I think insurance is a good time to talk about that. First of all, we accept all major insurance. The university does have a requirement that all students, all full-time students here have comprehensive insurance coverage. And actually all students are immediately enrolled in our university health plan, and that is through United Healthcare Student Resources. Parents can choose to waive out of that and maintain their children on their own personal insurance. But there's a few nuances to that. So first of all, it is a waiver that has to be completed. That's done through the student portal. It opens July 1st. It must be completed by September 5th if an individual is going to waive out of the university health coverage. And there's certain requirements. So when you enter that waiver tool, there's 9 questions you'll have to answer around some different things. First and foremost, Washington University Physicians Group must be in network with your health plan for us to be able to take it. All of our physicians and physicians assistants are credentialed through the Washington University Physicians Group. So that's an important requirement. It must be a US-based plan. So we are not able to take international healthcare, international health insurance plans at the health center. there can't be any limits on coverage, so no maximum benefits, and any deductible needs to be $3,000 or less per individual. So as long as your insurance meets those, we're in network, then we can absolutely take that health coverage. But again, we have the our United Healthcare Student Resources Plan that all students are automatically enrolled in. We don't have that plan quite finalized yet. We're waiting for the Missouri Department of Insurance to approve it, but it's going to be roughly $1,950 a year. So not a bad price for a full year of coverage. So those that choose to stay in that plan, that coverage is there. It fully covers you at our health center. But if you do choose to waive out, again, that would need to be completed by September 5th. It's an important part there. So.
Does Habif Health and Wellness offer vaccinations? What kinds of vaccinations can my student get from Health Center?
We absolutely do. We offer pretty much all of your standard vaccinations with the exception of varicella, which would be chickenpox. We're not able to maintain that. It's a very, the shelf stability of that vaccination is pretty difficult. Not a lot of students need that at this point, so we don't offer that. Some of your more exotic ones like rabies and yellow fever, we do have some students looking for those at times because they're going on trips abroad or doing work in a lab that involves, potential risk. We don't provide those, but we can absolutely help a student connect with the health department to get those in the community. But aside from that, hepatitis, HPV, MMR, Tdap, tetanus, all of your standard vaccinations we provide at Habif, and we encourage students to come and get those.
So let's say my student is going to Barnes Jewish Hospital or is referred out to Barnes Jewish. What materials do students need to bring, such as like a letter of proof from their insurance? What kinds of things should I talk with my students to make sure that they're prepared for?
Yeah, so we do handle the referrals in-house, so they wouldn't really need to bring anything. I mean, if they go to Barnes Jewish for an emergency visit, just like you would for any other emergency visit, they would want to have their insurance card with them. If they don't, the hospital obviously is going to treat all emergencies and ensure that the patient is cared for, and then you can kind of hear the insurance in the back end. But we encourage students to have their insurance card with them. If a student comes to us and needs to see a specialist, either at Barnes or another specialist in the community, we handle all of that referral process on their behalf.
So let's say my student needs to have some ongoing regular care. How would they go about setting up those regular visits or appointments?
So if we're talking medical care, we'll start there because we kind of separate medical and mental health on that. Within the medical care, I think setting up an initial visit with our physicians pretty close to when they're going to be arriving on campus. And then from there, they would be able to establish that routine and get on the schedule with our nurses, and our schedulers can handle that and facilitate that for them. On the mental health side, we operate kind of what we call a brief therapy model, just because of the level of need and the constraints of our staffing on campus. So students can have 9 free counseling sessions a year through our mental health program per academic year. If it's going to exceed that, we definitely will, we can bill insurance, we can do private pay and things of that matter. But if a student's going to need frequent and regular ongoing mental health care, so something of level like weekly visits, we really work with connecting them to a community resource. Unfortunately, we just don't have the capacity within the mental health center to provide that level of resource. But those short-term, brief therapy, we absolutely are equipped for that. Anything more than that, we will work with them to help them get the resources they need.
What are the hours of operation?
So we actually shifted our hours a little bit this coming school year. I think it's got to be a little more conducive to students getting in when they need to. So we'll be open Monday through Thursday from 8 a.m. to 6 p.m. On Fridays, we'll be open from 9 a.m. to 5 p.m. And then from Saturdays, we are open from 9 a.m. to 1 p.m., but that's strictly for urgent care. So we don't do any appointments on Saturdays. It's only walk-in urgent care needs.
Great, thank you. If we were to purchase the WashU insurance through United Healthcare, would it cover all appointments, labs, medicine, and ER visit or hospitalization?
Yeah, absolutely. It's a comprehensive plan. It's approved by the Affordable Care Act, so it does cover really what most insurances would cover. At Habif, so any services a student receives at our health center here on campus, there is $0 deductible and only $10 copays for office visits. We were able to negotiate that price down this year. We're really excited about that, helping kind of alleviate some of those stresses for students. Outside of Habif, as long as you're in network with other providers, there is a $350 deductible, and office visit copays are $25 and then $40 for urgent care visits. At past deductible, it's 80% coinsurance after deductible with an out-of-pocket maximum of $5,000 per person per year. Pharmacy, that plan covers pharmacy as well, with copays of $20, $45, and $75 for tier 1, 2, and 3 drugs. All preventative care is covered at 100%, whether received at Habif or outside of. Obviously, we're going to do that at Habif at the health centers, where we provide most of our preventative care. And then any mental health care is covered in the same fashion that medical is, according to the policy plan.
So can you tell me a little bit about the health fee and what that includes? Does that include health insurance? What is that? What falls under that health fee?
So the health fee does not include health insurance. So the health fee this year is, if I heard right, $500 per academic year. That is split between Habif Health and Wellness and the Recreation Center. So they're able to use that money to operate a fantastic rec center. If you haven't visited that yet, I would encourage you to do so when you get here. No relationship to Habif whatsoever with that, but it's a great program. But it also covers, at Habif, it covers all of our health promotion services. So we do a lot of events all year long to really encourage students and help them as they're kind of starting to gain that independence and develop some healthy habits. And then as well as those mental health visits, like we said, we have the 9 free visits a year. It helps cover that. And then we're able to just, because we have that fund, offset some expenses and provide a deeper level of care than maybe what you would get at a typical doctor's office. Our physicians are able to spend a little more time with students. Our psychiatrists are able to spend much more time than you would in a typical for-profit psychiatry department. So that's where that health and wellness fee that you're paying kind of goes towards that. Insurance, like I said, is separate from that. We expect it to be about $1,950 coming into this year. We're waiting for Missouri to approve that before we can officially announce that rate. But that insurance would be applied separately from the health and wellness fee.
Would the WashU insurance cover our student when they visit home or are out of the St. Louis area?
Yes, absolutely. It's through United Healthcare, which is one of the stronger networks in the United States for health providers. So as long as you have a UHC in-network provider in your area, it will cover there. And I think I mentioned earlier the referral. So with the student health plan, if a student does utilize that, they are required to have a referral for anything outside of Habif. But there are some exceptions to that, and one of those exceptions is when the student is more than 50 miles away from St. Louis. So if they are back home in Boston or Los Angeles or Baton Rouge, I think I heard, you would not need a referral. You'd be able to just go and visit your primary care physician there, assuming they're in network with United Healthcare. Since we're talking about that referral piece, so if they're more than 50 miles from St. Louis, any urgent care needs that are taking place outside of Habif's hours do not require a referral, and any emergency care whatsoever obviously would not need a referral for those emergency visits.
So what are the yearly coverage dates? So assuming the full calendar from September to September, or what does that look like?
Yeah, the insurance plan is effective August 1st, 2019, and will continue through July 31st of 2020.
Awesome. So if I were, say, trying to decide if I wanted to have my student be on WashU's United Health plan or on my own, how would I find information like the tax ID for the WashU Physicians Group or things like that to check if it's in network?
I do not have our tax ID prepared for us or right here off the top of my head. I apologize for that, but we'll add that in later. Like Reggie said, this will be uploaded later, this entire video, and we'll put some answers to some questions on there. So I'll have that information there at that time, but I don't have that available right now. You should be able to, within your health plan, just search for Washington University Physicians Group. An easy workaround might be to search for Dr. LeBlanc. That's Leblanc, Cherie. She's our executive director and one of our physicians. So if she's in network, the rest of them would be as well. But we'll make sure we have that information later. And as far as making that decision of which plan is best for you and your family, that's very individualized. We do have some families that maintain both and utilize the university plan and then their own personal insurance as a secondary coverage. You would need to speak with your insurance brokers, kind of what the best arrangement is there for you.
Are student athletes required to do a physical before arriving on campus?
You know, I am not sure about that. That is, I haven't worked a lot with athletics. I would talk to your coach about that specifically, but I would assume there is some requirement there, but I don't have that answer, unfortunately.
Are students able to get physicals at the Health and Wellness Center?
Absolutely. Yeah, we can provide your yearly exams, physicals for sports. If that is a requirement, that's definitely something we can provide at the Habif.
So we know you had talked a little bit earlier about the hours. Where should my student go outside of health center hours, such as like on a Sunday or something like that?
Yeah, obviously if it's an emergency, again, we recommend contacting Washington University Police Department. They can bring EST out. And even for things that aren't quite to that level of an emergency, EST is able to provide quite a bit of support. We also, after hours, you can call the Habif phone number, 935-6666, and after hours you can go to our nurse advice line where you can get some information at home to help you make that decision. Do I need to go somewhere? Do I not? But ultimately, if your child's sick, if your student's sick and they need to go somewhere, we have an urgent care. It's about a mile from campus on Big Bend Road, total access urgent care. They are in network with the university health plan. Again, $40 copay for urgent care. You would need to make, kind of determine if that's in network with your private insurance if the student maintains that. But that's our best recommendation for urgent care. And then, of course, Barnes Jewish Hospital is just on the other side of Forest Park for emergency needs.
Does the insurance plan cover dental?
There is an optional dental policy that can be purchased, dental and vision. I don't have those prices with me. If you go to our website, which I should have mentioned at this point, but habif.wustl.edu or shs.wustl.edu, either one will get you to our page. And you can actually look at the 2018-19 dental and vision prices, because that rate is actually going to stay the same for next year, assuming Missouri approves the plan as we presented it. But that is available as optional coverage.
For mental health, are professors allowed to contact the health center if a student is not attending class or exhibiting mental health displays or things like that?
Yeah, definitely. We have, our faculty, our residential college directors, RCDs. Those are all some of our best allies for mental health and ensuring our students are taken care of. So we frequently have those individuals contact us and express some concerns, and we'll try our best to reach out to those students and make those connections. We really work a lot with the RCDs, encouraging them to refer students to us when they have those needs. Parents can contact us at 935-6666 will be a good starting point. I'll find the 6695 is our specific mental health number if you have concerns about your student. There's some HIPAA regulations. We probably will be, the extent we can say is we're going to reach out to them and check on them. We may not be able to call you back and let you know kind of what the outcome of that is. So RCDs are going to be really your best kind of teammate on that to kind of keep touch with your students, see how they're doing here. But yeah, we have a variety of people make referrals of students to us for those things.
If I'm using an outside insurance, will my student be able to fill their prescription at the university's pharmacy?
Yes, definitely. Our pharmacy takes all prescription coverage plans. Should be no problem whatsoever.
Great. And one of the questions that we got was to repeat the urgent care name, and that's Total Access? Total
Access Urgent Care, yeah.
So will parents have access to the health and wellness portal?
I don't believe they do, and I will apologize for that. I'm fairly new to the university, being here since January, so that one that catch me off guard. It's done through your student access to the portal with their Wustl key. So I guess essentially if your student gives you their ID and login, you would be able to access it that way. We don't recommend that really. Again, we're looking for students that have some independence here, and work with them and kind of building some trust. So parents don't have direct access to that portal. Again, that's HIPAA protected. All that information does have to be maintained confidentially.
Can a parent or family member make an appointment on behalf of a student?
No, we really do need the students to take ownership of that, again, for HIPAA regulations and reasons of that sort. So we need students to take responsibility and make those appointments on their own. We are happy to consult with parents and hear concerns and kind of give what information we can provide, but we are looking for the students to be their own caretakers for those things.
Can a parent or family member oh, I'm so sorry about that. When should my student go to Habif versus the hospital versus staying at home versus urgent care, etc.?
Yeah, so again, if it's an emergency, if it's a true emergency, difficulty breathing, severe allergic reactions, things of that nature, call that FISTA 5, call Blue PD, get an EST there, they'll get paramedics there when that's needed, kind of first and foremost. Beyond that, just call us. If it's during hours, our nurses are great over the phone to just kind of consult with students and help them make that decision if they need to be seen or if it's something they can take care of at home. If it's after hours, we do contract with that nurse advice line. Those are registered nurses in all 50 states. So you would be able to talk through that situation on the phone, and they can help you make a good decision. If you need to go to the emergency room, if you need to go to urgent care, which is open again until 8 p.m. I don't know if I mentioned that before, but that total access urgent care is there until 8 p.m. Or maybe you can wait until the next morning and just get an appointment to come in and see us when we're open. So call us. If we're not available, you'll be able to talk to our nurse advice line, and they can help you make that decision.
Do you need students to submit vaccine records?
We absolutely do. That's extremely important. I'm glad somebody asked that question. All vaccine records need to be submitted. Now would be great, but by August 16th. Move-in date, I'm sure you all know, is August 17th. Any student that kind of arrives on campus on August 17th, all ready to move in, their boxes are all packed up. If that vaccination record and that health history form's not been submitted, you're not going to be able to take a single box out of your car and put it in your room yet. You're going to be sent straight down to Habif to get that all taken care of and get that up to date. So very, very important. Please make sure you have that submitted ahead of time. We will be open on August 17th to address those needs for anybody that didn't get that done, but it could be a bit of a wait if you do wait until that day. So have all that submitted online through the student portal, and you'll be taken care of.
We are going to ask one last question for the evening. As a reminder, any questions that we were not able to directly answer during the webinar will be addressed via email directly to the person who posed the question, and any clarification will be also uploaded along with the video. How does my student pay for appointments?
We take all forms of payment at Habif Health and Wellness, so they can pay with check, cash, credit cards. They can use their Bear Bucks, or they can even have it applied to their student account. So if they're worried about co-pays or things of that nature, we don't want that to be a setback by any means, or any co-insurance with the labs or pharmacy even can be billed to their student account and then adjust later. I mean, parents are offsetting those funds. So pretty much any variety of ways can be paid for. So we encourage students not to allow those finances to keep them from getting their healthcare needs met. Come on in, we'll get it taken care of, and we'll work with you from there.
Aaron, the information you provided this evening was extremely helpful. I am confident families of students in the class of 2023 have learned a lot from your presentation and your presence. Do you have any final pieces of advice or action steps families can accomplish during the summer in order to help their student be ready for the fall?
Right. I think if you spend some time on our website, obviously the First Year Center website has some excellent information to prepare you around our health and wellness resources. Also, if you go to habif.woosle.edu and just spend some time looking around there, talks a lot about what we can provide and ways we can connect your students with the care they need. Aside from that, I would just really encourage you to get your immunization record and health history form completed. Again, if it's not done by August 17th, it's going to delay your move-in. We don't want to do that. It's an exciting day. We want you to come in and be able to unpack and get into your room and go about the orientation week. So make sure that's done. And then if you plan to waive out of the health insurance, September 5th is the deadline. If that's not completed by September 5th, that bill will stay, that charge will stay on your bill, and you will have an extra health insurance plan that maybe you don't want. So really, really make sure that if you're planning on keeping your family insurance, that you do that waiver. That should open on July 1st, and September 5th is the close date for that. We'll have more information about the health plan just as soon as it's approved by the state of Missouri. We're every day checking emails, hoping that comes through. But that information will be published very soon to help you make that decision. In the meantime, if you have any questions, don't hesitate to reach out to us. Our contact information is on the website, and we're happy to answer whatever questions you have to help you with the transition and get moved in for the first year.
Okay. Thank you all for joining us.